Okay, welcome back, colleagues. Perhaps if we can make a start. I think it was an excellent beginning to this orientation course, and thanks to Richard and John for that first session. We now have two back-to-back sessions. The first, or the second session on the agenda will deal with international cooperation and assistance, and then I'll hand back over to John for the third session, which will look at science and technology. In terms of this particular session, as both Richard and Ambassador Dr. Malou alluded to, international cooperation and assistance are topics that have become increasingly important in the Biological Weapons Convention. Certainly in terms of assistance, natural disease outbreaks such as Ebola and now COVID have increased attention to Article 7, which deals with the provision of assistance. And I think this is an area where there has been some useful discussion. Similarly, international cooperation under Article 10 of the Biological Weapons Convention has become increasingly important as the convention has evolved. To provide an overview of cooperation and assistance, I'm delighted to be joined by Dr. Roselida Owuor, who is a Kenyan expert on biosafety and biosecurity, and she's spoken and engaged in the BWC for a number of years now, at least since 2009. She's also speaking in her personal capacity. If you do have questions, please do submit these as and when they arise. We do want to keep this informal, so please feel free to ask any questions that you may have. And with that, I'll pass over the floor. Dr. Owuor, you have the screen, the floor. It's over to you. And Letitia, have you got slides? Could you put those up? Thank you, Letitia.
Thank you. Thank you for this opportunity that you have given me to speak under international cooperation and assistance. I didn't prepare any slide, but I have a presentation that I may not be able to share with you from the other side, but definitely I'll go over it in the next 10 minutes. Is it okay?
Yes, that's great. Please proceed. Thank you.
All right, thank you. So international cooperation and assistance, this is clearly stated in the Article 10 of the BWC and also Article 7, where the Articles 10 of the Convention call for the fullest possible exchange of equipment, materials, and scientific and technological information for the use of the biological agents and toxin for peaceful purposes. In a nutshell, this particular convention simply supports the peaceful uses, access to technology, and export control. And under Article 7, it requires that each state party to provide or support assistance in accordance with the UN Charter to any party to the convention, which so requests if the Security Council decides that such party has been exposed to danger as a result of the violation of the convention. And looking at the 7th Review Conference, there was a lot of discussions around the Article 10 that supports the international cooperation and assistance. And the 7th Review Conference called upon state parties to undertake certain implementations under the Article 10, and this involved continuous strengthening as existing international organizations and network working on infectious diseases, in particularly with those of WHO, FAO, OIE, and IPPC. It also required improved communication on disease surveillance at all levels, including between state parties and with the WHO, FAO, OIE, and IPPC. There was also a requirement for continuous establishing and improving national and regional capabilities to survey, detect, diagnose, and combat infectious diseases, as well as other possible biological threats, and integrate these efforts in national and regional emergencies and disasters management plan. Also, there was need to continue supporting capacity building in state parties in need of assistance in the field of disease surveillance, detection, diagnosis, and combating of diseases and the related research, and also to promote the development and production of vaccine and drugs to treat infectious diseases through international cooperation. Previously, what used to happen is that the state parties used to request for assistance and also cooperations by themselves. But with the review of the 7th review conference, one of the final declarations included creating a database for assistance, request, and offer. In addition, there was also a need to establish a sponsorship program to support the state parties which have not been able to participate in the meeting of experts and also meeting of state parties. This particular program is managed or administered by Implementation Support Unit. So under the database for the assistance for request and offer, which was actually meant to facilitate request and offer of exchange of assistance and cooperation among the state parties, there was need to provide information and use this particular database directly. However, there was need of informing ISU of the matches. This particular database is administered by ISU, and the database for assistance request and offer includes general offer and data offers request. So under the general data, there is support under the international cooperation and assistance, which is provided. Ratification is one of them, national implementation, legislation and administrative measures, emergency response, export, import, and also control regime. And also biorisk management, which actually includes the issues of biosafety and biosecurity, and also the support for confidence building measures, seminars, courses, and training. However, various state parties normally have their own requests depending on what they have at hand. Among the ones that have been listed above under the general offer, but in the past there have been some requests under science cooperation and joint research to improve prevention, detection, and response. Looking at what the state parties have been able to achieve in terms of the international cooperation and assistance, various state parties have benefited under legislation where some state parties have been assisted to develop their legal framework under the domestication of the BWC. And also there've been capacity building, which have been included education and training, and biosafety and biosecurity in terms of equipment support and also infrastructure. State parties have also benefited in terms of assistance on how to fill the CBMs and how also to submit them online. Also, some state parties have benefited under disease surveillance and detection. However, there is more that is required in terms of international cooperation and assistance in improving and coordinating national implementation of BWC, legislation, regulation, law enforcement, export control, and also issues of biosafety and biosecurity. Because when you see most of the state parties, to some extent, they confuse the two terminologies in terms of biosafety and biosecurity, and there is need for the state parties to speak the same language now that they are a family. Then there is also need for more assistance in scientific oversight, education and awareness raising, and disease surveillance and response capacity. In conclusion, I wish to say that BWC is a family of 183 state parties, and international cooperation and assistance should be encouraged, especially at this time of COVID-19 pandemic, where some state parties have been hit quite hard. Thank you, and back to you, Jamie.
Thank you very much, Roselida. I'd welcome any questions that participants may have. I have a couple myself that I'd like to sort of explore. First, you mentioned biosafety and biosecurity as being different, and I think I certainly agree. There are issues with the definitional factors there. Without wishing to put you on the spot, would you be able to provide an explanation of the difference between biosafety on the one hand and then biosecurity, because you say they are clearly quite different? It also strikes me as important to perhaps raise people's awareness in preparation for past review conferences. There's often been Article 10 reports in which states parties submit activities they've undertaken in support of Article 10. That's something which I assume will go ahead at the next review conference as well, and might be useful to consider. And I also wonder whether you might be able to touch upon some of the issues of what's often termed the regulatory aspect of Article 10. So some states view restrictions imposed on the transfer of certain materials and technologies by the Australia group as being potentially hampering Article 10, and this has been a cause of frustration for many states. So there's a couple of points to follow up on that, but also I'd encourage people to submit questions as they arise. If you could pass those over to you though first, Roselida.
Thank you, Jimmy. I'll give you my simple definition of the biosafety and biosecurity. It has not been agreed at the state parties level what really we need to, how we need to define the two terminologies, but by one way or the other, we seem to be moving in the same direction. Biosafety is simply, in a simple term, to a layman, would be the safety of those who are involved or those who are working with the biological agents, which can be used for mass destruction, either animal, humans, or even plants and environment also. But when we look at the biosecurity, this is now the safety of these particular biological agents that can now be misused by people who have wrong intentions to be able to encourage mass destruction, either of plants, animals, humans, or environment. So when we are talking about biosecurity, we are protecting the biological agents. When we talk about the biosafety, we are protecting those who are using these particular biological agents. That is the simplest definition which I can give at this particular point. Jimmy, I hope I've been able to answer you. The other question, I didn't get it. Do you mind repeating it?
First of all, I think that's a really useful sort of explanation to kind of bring in those differences. Perhaps a question which is more suitable, or perhaps something I'd be interested in your own experience, because you've been involved in a number of international cooperative activities, and I think you've spoken about these in the past. Would you be able to talk about any lessons learned from those experiences, or how they've worked and what's been done, and what you think has been particularly useful in your own experience?
Thank you, Jimmy. Yeah, the lesson learned under international cooperation and assistance. Let me talk about the positive ones. The positive ones being that both the state parties who are under cooperation normally benefit from one way or the other, in the manner that there is always something to learn or to gain from the other state party. Both ways. For the case of those who are getting the assistance, they are able to realize some of the challenges that they face under the implementation of the convention. And what has happened in the past is that the state parties who have something to show, there have been arrangements where the state parties who wish to learn something from the other state parties, there's always visits and also shared surveys in terms of finding out either the status of the biosafety or the biosecurity. And sometimes they've been support in terms of the infrastructure. At the same time, they've also been support in terms of the capacity building. So the international cooperation and assistance work once the two state parties are able to gain from each other in whatever way that either through the expertise or even in terms of the infrastructure or any other form that the other state party feels that this is the area where there is a gap that they need to fill and another state party can be able to support. So what I can finalize with is to say that there is need under this international cooperations and assistance, the trust. Once the trust is there, then the state parties have a long way in terms of achieving what they want to achieve for the benefit of their country in terms of the implementation of the convention. Thank you. Back to you, Jimmy.
Thank you. There seems to be some discussion. I would encourage if people do have questions, please do submit these to the Q&A. There seems to be some discussion around some responses on biosafety and biosecurity. It's perhaps not surprising because I think for a lot of the time that I've been following this convention, the difference between biosafety and biosecurity has sort of confused people because I think, as you pointed out, there's no clear translation into the other languages and the concepts are not always, in some cases, quite new, I think, for states parties, and certainly in earlier intercessional processes. I would, if people are interested in this, I think in 2008, there was a background document by the Implementation Support Unit, which provides a definition of biosafety and biosecurity within the context of the BWC. That could be contested, but I found that distinction quite useful. Okay, we have another question that's come in, and this relates to the Australia group. Is this a suitable forum for biological export controls during COVID? And this gets into questions over some of the regulatory aspects of Article 10. I could hand that, but if anybody else on the panel would like to jump in and address that, because I know, Richard, I think you referred to some of these points earlier on as well, but if you want to take that, or anybody else, Roselida, hand it over to you or colleagues.
Thank you, Jamie. Can I request one of my colleagues to handle that? Thank you.
Yeah. Anybody else, John or Richard?
Oh, there we go. Yeah, the Australia group. I mean, it's a good question, and I think, I mean, one of the discussions during the protocol negotiations was what to do about the Australia group, and should the Australia group be kind of multilateralized or universalized somehow through the protocol. Obviously that was controversial and certainly was never agreed. I think what perhaps the last 20 years has shown is that the Australia group performs a very useful function. There are a number of countries which, for example, use the Australia group lists for their own export controls, even though they're not members of the Australia group. Or they base their own lists on the Australia group. On the other hand, you know, you could see there would be benefit in having a totally harmonized multilateral system where there are standard lists that everyone both adheres to for export controls and also has a say in determining what goes on the list. I think you could make a case, yeah, that's something that should be multilaterally decided. But you know, in terms of COVID and the role of the Australia group, I mean, I think in general, in terms of preventing terrorists and non-state actors from getting hold of potentially dangerous biological pathogens or the equipment necessary to make them, then, you know, unquestionably the Australia group plays a very important role. There are some other political concerns, and I think one of the problems with the Australia group and with export controls in general is I think there's maybe not enough awareness of the effects of, let's say, conservative export control decisions, or even sort of flow-on effects of self-censorship, if you like. It's not quite the right word, but producers and exporters deciding not to sell stuff to certain countries or to certain destinations because they don't want to bother with all the export control bureaucracy. And we see that like in things like freight companies being reluctant to carry vaccines or important diagnostic materials to developing countries who really need them urgently. I mean, this is a factor I've heard several times when I've been traveling, doing workshops and so on BWC national implementation in developing countries, particularly in Asia, Africa too, saying, talking to healthcare professionals who express a lot of frustration in getting timely access to diagnostic equipment, to diagnostic reagents, and other things they need to do their jobs of disease surveillance and control. And I think perhaps there's not enough attention given to that by some exporting countries, because their concern is with, what they call proliferation risks. I mean, we're all friends here. Let's name names. They're concerned about exports to Iran, say, or to China, or I don't know. But they are perhaps not looking so carefully at what the follow-on effects are of these policies are to genuine peaceful use of materials. I don't think it's an intentional policy. I don't think anyone's trying to restrict access to necessary health products for developing countries, but it's kind of an unintended consequence, if you like. So, I mean, but that's something that could really be looked at. And I think if you could have a discussion about that without it getting too political and too much finger pointing, and just as a practical matter, how do we solve this? I think that's something for Australia Group members to think about. And I think it's something for BWC states parties to work on as well.
Thank you, Richard. I think that's really useful. We've had a couple of questions come in. I think there's one here. I'll direct these to all panelists if anybody wants to chip in, but first perhaps to yourself, Roselida. How could the private sector be more involved in activities in relation to international cooperation? And are there examples or evidence of public-private partnerships in this field that you're aware of?
Thank you, Jimmy. And thank you for that question. It is very key for the private partners to be able to be engaged in this particular convention when it comes to international cooperation and assistance, because by the end of the day, we cannot be able, or even as a government or any other entity, to fight the war alone, or to implement the convention as expected to prevent any unpeaceful use of this particular select biological agents. So it is very key, even when we are coming up with the legislations, to involve the private partners quite from the early stages of the development of these particular legislations, and also clearly state their roles when it comes to international cooperation and assistance. And for these particular cases, it's good to identify which are these particular areas that we want them to participate in. Thank you.
Okay. Thank you very much. I've got a couple more questions starting to come in now. So I'll try and cluster these. So if I can, first of all, there's an interesting question here about the role of biosecurity, public health security, and the linkage with risk communication during a pandemic, which I think is perhaps something that the importance of this has become much clearer over the past couple of months. We also have a couple of questions on a question here on the role of the BWC in helping countries which are currently perhaps facing sanctions as well. But if I could perhaps start with the biosecurity, health security, risk communication during a pandemic question, because I think that's particularly interesting. Roselida, you have the floor.
Thank you. With the pandemic that we have currently, it is very key to undertake the capacity building and also to involve those who are actually now being like frontliners when it comes to handling of this COVID-19 pandemic. At the same time, this is the time now when we need to tighten the biosecurity aspects, especially where in developed countries where we have challenges in terms of the equipment or the facilities in the particular lab. This is the time now to be able to sensitize or create awareness for those who are involved with this particular handling of the COVID pandemic, and at the same time also engage the public in terms of what is it that they need to do in terms of the protocols that is going to protect them as far as biosafety and biosecurity is concerned during this particular time.
Thank you very much. I'd actually just be interested to follow up on that, because you mentioned raising awareness among scientists and public. Are there good examples or indicators that you could point to of that being done in the past? Because it's an area which comes up several different aspects of the Biological Weapons Convention discussion.
Thank you, Jimmy. Yeah, I will say, and then some another panelist can add something. Yes, they've been in the past also the awareness creation and education, and this has been under partnerships between some developed countries and also developed countries who are the state parties to the convention in terms of coming up with a program and also enhancing some of the education or higher education training entities to come up with a curriculum that addresses the issues of biosecurity and biosafety. And under the international cooperation and assistance, a country like Kenya now has a program or a degree under biosafety, and they're working on something under biosecurity as a degree program. Thank you.
Thank you. I don't know whether anybody else wanted to come in on that point. Otherwise, I'm happy to move on. There's quite an interesting question talking about the convergence of biology and chemistry and how these technologies are becoming closer together. And there's a question related to the implications of this convergence for preventing the spread of biological and chemical weapons, suggesting this has become more serious. How does this impact upon the BWC, and how could this affect international cooperation as well, this convergence of different technologies?
Thank you, Jamie. Is that mine, or I can throw it to another panelist?
I think that's to you, unless there are any other volunteers from other panelists.
All right, thank you, Jamie. Okay, fine. With the advancement in science and technology, we expect a lot of the convergence between biology and any other related fields, not even chemistry alone. But with this, what needs to happen is that we need to look out in terms of where there is this convergence, and if there are any issues that can bring about the matters of concern that can work against the convention. And here what I mean is that where there is convergence either between biology and chemistry in terms of the research or technology advancement, then we need to clearly identify what are the products and what are we using in terms of this convergence that can be of a concern to the convention. Thank you.
Thank you very much. Okay, there are a couple of questions remaining which refer to issues related to the protocol and sort of conditions for international cooperation of the protocol. But I think I'll leave those for now, because I'm quite keen that there is a short pause between each of these sessions. So with that, what I would suggest is if I hand over to John, John will start in about 2 minutes in the next session, which looks at science and technology. So John, I'm hoping you're there somewhere. I'm going to hand over to you the next session, and we'll pick that up in about 2 minutes. So if people want to stretch the legs or have a quick walk around, then please feel free to do so. We'll be back and we'll start promptly at 11 o'clock Central European time, if that's okay. Okay, thank you very much. And thank you to Roselida for your contribution and for your patience in a sort of intensive series of questions. Thank you.